think we have 2 minutes. Please open up so that participants can join. 7 minutes.
Recording in progress.
Good morning, good afternoon, good evening, colleagues, depending on where you're joining us from. And we'd like to say welcome to the Africa CDC weekly press briefing on COVID-19, the situation of COVID-19 in Africa. Colleagues, let's also use this medium to apologize to you for the abrupt change last week. That was due to the director's inability to join us because he was in a very serious and urgent emergency meeting last week, and we had to call off the briefing for last week. But as you're aware, this event has been hosted by Africa CDC since the onset of COVID-19. We've had this briefing over the last 2.5 years to update the continent through you, the media, colleagues of the media, about the COVID situation on the continent. That includes the the vaccine situation, and of course, how member states are transitioning gradually to the post-COVID era as the pandemic progresses. So today we have with us Dr. Ahmed Ogwell, Ouma, the acting director of Africa CDC. He's going to gave us the briefing today that includes all of the stats that our surveillance team has put together. And the director will also briefly dive into the situation around monkeypox. And then we will move on to the question and answer section of our briefing, where you, the colleagues of the media, are given the opportunity to ask your question, and the director will be available to respond to the questions respectively. So today, we will be using the regulatory medium for the questions, and that includes our regular WhatsApp number, that's +251 94 2310. I read that again, 251 94 2310. In addition to that number, you can also use the Q&A section on your Zoom screen at the bottom. to send in your question that will be read to the director. And of course, the option of raising your hand also at the bottom of the Zoom screen. You can use that and you will join us live to ask your question. My name is Ogwell. I'm sitting in for our usual moderator, Madam Wayne Musaboyana, who is not available with us today. So without much time to waste, let me take you straightly to Dr. Ahmed Ogwell Ouma, the Acting Director of Africa CDC, for our briefing today. Director, it's over to you.
Thank you. Thank you very much, Nick, and good morning, good afternoon, good evening, wherever you're joining us from today. Welcome to this weekly press briefing that we are really now expanding a bit just beyond COVID to all the other areas that Nick has mentioned there. Let me also echo that apology. Last week was budget week, and unfortunately, due to scheduling changes, our time for the press briefing clashed with me being on the floor addressing issues of budget. But let's start with the press briefing today. And let me start with the COVID-19 situation on the continent. As of today, we are reporting 11.6 million cases cumulatively since the beginning of the pandemic, which is about 3% of the total cases reported globally. In terms of recoveries, we are at 11 million, which is about 95% of the total number of cases that have been reported in Africa, while deaths are at about 253,000, which gives us a cumulative case fatality rate of 2.2% here in Africa. And these deaths account for 4.1% of the global deaths due to COVID. The top 5 countries, which are reporting 61% of the cases in Africa, remain quite stable from last time. South Africa with 34%, Morocco 10%, Tunisia 9%, Egypt 4%, and Libya 4% of the total numbers reported on the continent of Africa. In terms of case fatality rate, this week, 40 countries are reporting a case fatality rate that is higher than the global average. And 2 countries, Somalia and Sudan, still remain with a relatively high case fatality rate of above 5%. Looking at the waves, the situation has not changed from the last time that we held a press briefing. So I will not go through that in detail, only to say that one country, Mauritius, still remains the only one that has experienced a 6th wave, and all countries that were reporting 4th and 5th waves, the situation remains the same. In terms of variants of concern, the situation also remains the same, and I will not go through that detail unless we get a change in the situation of the variants of concern. But related to the variants of concern and related to the pathogen genomics that we are doing on the continent, we do have a milestone to report today where we are seeing the 100,000 sequenced sample. So we have sequenced 100,000 sequences since the beginning of this pandemic, and it's a very big milestone for us here in Africa, and we are commemorating that. Tomorrow at 3 p.m. East African time, we'll be holding a virtual conference to discuss sequencing on the continent and the lessons that we have learned in sequencing the 100,000 genomes on the continent. So be there. The details are in the pack that has been shared with you, and will be on all our platforms as well. The epidemiological trends over the last 1 week This is EPI week 22. When we look at the number of new cases compared to week 21, we are seeing a total of 28,232 new cases being reported in Africa, which is a 16% decrease from the previous week. The highest proportion of new cases still remained the Southern Africa region, with 66% of the new cases during EPI week 22. The following 5 countries are reporting the highest numbers of the new cases during EPI week 22. South Africa with 14,238, Ethiopia 2,666, Morocco 2,300, Namibia 1,619, and Zimbabwe 1,305. In terms of the incidence per million population, the following 5 countries are reporting the highest cases in that order: Seychelles, Namibia, Cabo Verde, Eswatini, and South Africa. These are daily incidence rates per million population. In terms of deaths, during EPI week 22, a total of 215 new deaths were reported on the continent, compared to 235 during the previous week. And this represents a 9% decrease in the number of new deaths due to COVID-19 during EPI week 22. When we look at the analysis over the previous 4 weeks, what we see is that there has been an overall 12% average decrease in the number of new cases being reported, and by region is as follows. The Eastern Africa region reported a 90% increase in the number of new cases during that month, 36% increase in the Northern Africa region, 35% increase in the Western region, 12% increase in the Central region, and 19% decrease in the Southern region. In terms of countries with the most population, during the past 1 month, Ethiopia reported a 109% average increase in the number of cases. Kenya, a 70% average increase. The DR Congo, 51% average increase. Nigeria, 41% average increase. Egypt, 60% average decrease. South Africa, 23% average decrease. Number of deaths during this 4-week trend analysis, we see that there has been an overall 5% average increase in the new deaths reported on the continent. On COVID testing and medical supplies, to date, over 109 million COVID tests have been conducted in Africa since the pandemic started. Over 506,000 new tests were reported for the EPI week 22, which is 30 May to 5th of June this year. This represents a 26% increase from the previous week, when we only had 400,000 tests done across the continent. So far, the cumulative positivity rate is 11%, and the test per case ratio is 9.3%. But for the EPI week 22, that is 30th of May to 5th of June, the positivity rate is 6%, and the case per test ratio is 12%. It is important to note that the positivity rate has decreased by 33% over this EPI week 22, while the positivity rate has increased by 50%. So the number of tests being done are varying. We see an increase, while the positivity rate we are seeing a decrease. When we look at vaccination across the continent as of yesterday, we see that the total vaccine doses that have been supplied to Africa now stand at 818 million to 54 member states. The doses administered stand at 579 million, which represents about 70.7% of the total supply of vaccines available on the continent. However, the average coverage of the population that has been fully vaccinated, unfortunately, still stands at 17.3%, which is very far from our target of 70% as we set last year. The member states that have vaccinated the most of their population include Seychelles at 80.6%, Mauritius at 76.5%, Rwanda 62.6%, Morocco 61.7%, Botswana 61.3%, Cabo Verde at 54.6%, Tunisia 52.7%, Mozambique 43.1%, Sao Tome and Principe at 40%, and Lesotho at 37.6%. Many countries, indeed 37 countries out of the 55, are offering booster doses in different age groups across the continent. 2 countries, and that is Tunisia and South Africa, have now begun offering a second booster dose for those citizens above the age of 50 years old. Only 2 countries are now offering a second booster dose, and that is Tunisia and South Africa. Let me add here that we are encouraging our member states to offer booster doses to citizens who have already received their full vaccination coverage, so as to ensure that their immunity remains high and to avoid situations of serious illness amongst those who have been vaccinated. We encourage our member states to offer booster doses for those who are eligible. We must also add here that as we were using the 2020 population averages, our calculations have now changed, and we are now using the 2022 population estimates as provided by the UN FPA to give even more accurate projections in our planning and the figures that we are providing. I would like now to move to the situation of monkeypox on the continent. As of yesterday, we had documented 1,088 confirmed cases and no deaths arising from monkeypox infection, and this has been reported across at least 29 of our countries on the continent. I mean, in the world. Those cases that have been documented globally come from 29 countries, and all those who are reporting outside of Africa, mainly Europe and North America, are countries where monkeypox is not endemic. When we look at the situation in Africa, we have 10 countries that we consider to be endemic for monkeypox, the infection. And across these 10 countries on the continent, we are looking at 1,495 cases that have been reported from the beginning of this year, 2022. We have also seen 66 deaths, which gives a case fatality rate in Africa of 4.4% for monkeypox. And the countries reporting cases of monkeypox this year include Cameroon with 25 cases and 2 deaths, the Central African Republic with 17 cases and 2 deaths, Congo, Brazzaville, Congo the Republic with 5 cases and 3 deaths, the DRC with 1,284 cases and 58 deaths, Liberia reporting 7 cases with no deaths, Nigeria 66 cases with 1 death, Sierra Leone 2 cases and no deaths, Ghana 1 case and no deaths. It must be noted here that only one non-endemic country in Africa is reporting a case, and that is Morocco, which has reported 1 case, which seems to have been having a travel history to France during the preceding days. So we have 7 endemic countries reporting cases and 1 non-endemic country, which is Morocco, reporting 1 imported case. As Africa CDC, we have also conducted some preliminary assessments on the continent to look at the risk levels. And at the moment, we can say that the risk levels are moderate, given the fact that monkeypox is not very easily transmissible. It is self-limiting and with a relatively low mortality rate. We continue to closely monitor the situation, and we will reevaluate the risk level periodically based on the numbers and the response that we are seeing on the continent. We have issued an advisory already. It is on our website. But in summary, what we can say is that as Africa CDC, we have already activated within our Emergency Operations Center a team that is following very closely and monitoring the situation on the continent and also globally. We have also initiated a One Health approach to this particular intervention by bringing on board all our assets beyond human health, in animal health and the environment, to be able to get an accurate picture across the continent. We are also in very close communication with WHO at all levels, headquarters, the Regional Office for Africa and the Regional Office for the Eastern Mediterranean region, so that we have very clear picture of what is going on the continent. And globally, we are in touch with our counterparts in Europe, the ECDC, and our counterparts in the US, the US CDC, so that we can share information in real time. We remain in very close communication with our member states who are affected, the 8 countries. And our Pathogen Genomics Institute has also initiated and is coordinating additional sequencing support to the detected cases, so that we can have a good feel of which types of the virus is actually affecting the different countries. And we will be providing more information on this. Next week, we are actually providing training in diagnostics for monkeypox to member states, and the venue will be Abuja. In as far as vaccination for monkeypox is concerned, we know that this particular virus is very closely related to smallpox and that whole family, and therefore vaccines that work for smallpox would work very well for monkeypox as well. We also know that there are 3 vaccines that are currently available: the one from Bavaria Nordic, the one from Sanofi Pasteur Biologics, and the one from Aventis Pasteur smallpox vaccine. However, we are not yet actively vaccinating on the continent due to a lack of vaccine, but we recommend ring vaccination where we treat those who have been diagnosed and vaccinate the people who are around them. In this way, we can be able to interrupt transmission of this virus as quickly as possible and reduce the risks for serious illnesses. We can also report that there are very small stocks of vaccine stockpiles across the world, with WHO only holding a small amount, I think about 2.4 million. In Africa, we do not yet have any stockpile, and we are working with countries to see if there will be need to go beyond isolation and interruption of transmission using non-pharmaceutical methods. One important event that will be happening next week is we have two specialized technical committees at ministers level, one on health and another one on justice and legal affairs, who are going to be considering the process of giving Africa CDC full autonomy. The Statute of Africa CDC is undergoing amendment, and these two sessions of the various ministers are going to be held next week here in Addis Ababa, and we are looking forward to them passing those amendments to the statute and providing Africa CDC with a statute for autonomy and for ability to respond quickly to any disease threats on the continent. So this is what we had for you today, and we'll be happy to receive questions and provide further clarifications as may be needed. Nick?
Thank you, Director. Very insightful and succinct information covering both the COVID-19 situation on the continent and, of course, the monkeypox as it has re-emerged in Africa over and again, and emerging in some parts of the world that have not experienced monkeypox before. So we will begin your question, posting your question to the Director for responses. And as we said, the medium to do that, one, our usual WhatsApp number, +251 94550 2310. I read that again, +251 94550 2310 is the WhatsApp number to send in your question. Remember to indicate your institution and, of course, your full name, so we identify you. The second options, or two other options, are one, our Q&A section on the Zoom platform, just at the bottom, and of course, the raise hand if you want to join us live. I think we've got a barrage of questions, and we're going to begin just in our question and answer session on Zoom. We will start with our colleague, Judith Akolo from the Kenya Broadcasting Corporation, and then we'll move along the line. So colleagues will try to categorize the questions, the one that relates to COVID first, because remember this briefing is about COVID as usual, but then we are also diving into other outbreaks that are happening across the continent. So we are going to categorize the questions. The ones that are related to COVID, we will pose them to Director, and then we move on to other ones relative to monkeypox. So Judith's first question is around COVID, and she says, what can we make of the rise in infections that are being registered in Kenya? I'm asking this because you said it is only Mauritius that is reporting the 6th wave. And then let me just use that bracket and ask her second question, which is also related to COVID. My second question, we are noticing that even as the infection rate at 6.6% as at yesterday, the number of hospitalizations are low and even fatalities. Will it be right to say that Kenya is nearly achieving the herd immunity? So those are two questions from Judith regarding the issue of increase in cases and, of course, the issue of herd immunity. Over to you, Director.
Thank you. Thank you, Judith, for that question. For us to designate the rise in cases as a wave, we need a level of sustainability in the numbers. And Kenya at the moment is seeing cases rising, but it is not sustained in a way that we can call it a sixth wave yet. And I hope that the Kenyan government will work to keep the numbers low so that we don't get into another wave. In as far as herd immunity is concerned, this can only be confirmed when we have enough people who have immunity, either through vaccination, which is what we recommend, or through previous infection. This kind of information we still don't have. We've not done a study to see what kind of levels Kenya would have. By and large, we really need to increase the number of those who are vaccinated so that we are confident that the immunity that is there within the population is nearing herd immunity as much as possible. And herd immunity does not relate to hospitalizations and deaths. It is really just the level of immunity that is there in a population and can be able to protect those who may not have yet been exposed to the virus, either through infection or through vaccination. So herd immunity, you can still not yet mention that for Kenya. But for the sixth wave, we hope it doesn't come. And the numbers, if they become sustained, we will then be able to designate a country as going through another wave. Thank you.
Okay, thank you, Director, for the very clear answer to that question. I'm sure we're going to transition into the issues around monkeypox, since it's becoming a topical issue in public health across the world right now. So with that, we will move to Dorcas Wangiri. Dorcas has a question surrounding monkeypox. We'll begin with hers. I know the conversation is going to center around monkeypox right now. And Dorcas, can you hear me? I hope I'm clear. Can you hear me? Hello? Can the studio hear me? Okay.
Yes, so yes, we can hear you.
Okay. So Dorcas is with the BBC. She's based in Nairobi. And Dorcas' question says, during the last briefing of Africa CDC, you mentioned Morocco and Sudan were investigating suspected cases of monkeypox. What is the status of this? And second to that question, has Kenya also reported suspected case? There were reports that suspected samples were sent to Senegal. How much the Africa CDC knows about that? I think that's the question.
Yes, no, thank you. Thank you, Dorcas. At the moment, the only confirmed case out of the two countries we mentioned last time is Morocco. That particular case is in isolation, being managed to avoid any spread within the community. For Kenya, no, we have not yet had any confirmed cases or case from the country, but our surveillance is very awake and we are watching out for any suspected cases that we may come across the whole continent. Okay,
thank you, Director, for that response. Before I go to the colleagues who are raising their hands, let me go back to Judith. Judith's question is also around monkeypox, and her question is rather more of like preparing for preventative measures. So Judith says, I would like to find out what is the mode of transmission of monkeypox and how can one prevent transmission? This is because we need this information so that as we report on it, we are also able to provide ways in which the public can prevent transmission. Thank you very much for that notice. So the question in here is, what is the mode of transmission and how can one prevent transmission of monkeypox? Over to you, Director.
Thank you very much, Dorcas. And monkeypox is transmitted by close touch. One through bodily fluids. One has to actually come into contact with the individual who has the virus. And that's why I was saying earlier that it's not very easy to transmit, not as easy as those that are transmitted through droplets. So it is through touch, close touch, and to limit transmission from one individual to another, we are saying that we need to keep very good personal hygiene. You wash your hands, you don't touch anyone who is suspected to be unwell. Anyone who is unwell quickly gets the medical attention that they need. We avoid crowding, particularly where you'll be touching each other closely. And then we provide information to the public that this particular disease is possible to manage, and the risk of hospitalization, death is very minimal, and therefore we need to go out and seek medical attention if we suspect that we are unwell. So close touch, physical touch, and good personal hygiene will be able to keep us safer from contracting monkeypox.
Okay. We'll come back to the questions in the Q&A and, of course, the ones that are coming in on the WhatsApp group. But first, before we do that, let's move on to our live section. We have got two colleagues who have their hands up for a couple of minutes now. We will start with Maria Chen. Maria Chen, you will introduce your institution and we will take your questions to the director. Maria Chen, are you there? Colleague, kindly allow Maria Chen to speak. Maria, can you hear us? Hello.
Hi, this is Maria. Can you hear me?
Yes, we can hear you. Go ahead.
Thank you so much. I'm from the Associated Press. I do have a monkeypox question. During your last press conference, Dr. Ogwell, you mentioned that Africa had previously used some smallpox vaccines to contain monkeypox outbreaks, that there were some small stockpiles. And in the last week, my colleagues and I have spoken to numerous African public health officials, including at the World Health Organization, who said that this has never been done, that smallpox vaccines have never been used in Africa for monkeypox. So I wondered if you could clarify what the situation was. And secondly, given that WHO is creating a mechanism to distribute monkeypox vaccines to rich countries, I wondered if you felt that's appropriate, given that this has never been done for Africa. Thank you very much.
Thank you, Maria. And indeed, that will require clarification. The message I was passing is that the smallpox vaccine can be used for monkeypox, but for the avoidance of doubt, on the continent, we have never vaccinated using smallpox vaccine. We have always used non-pharmaceutical measures to be able to contain every outbreak of monkeypox that has come onto the continent. We have not used smallpox vaccine. The message is that it can be able to be used. On the issue of making smallpox vaccines available outside of the endemic countries in Africa, this is a huge concern for us. By and large, what we want to do in public health is to protect the most vulnerable. And in our situation, the countries on this continent that have endemic smallpox infection should be the first on the queue for any vaccines that are going to be released. And as I'd said, we would like to vaccinate those that are around any individual that has been found to have smallpox. The place to start any vaccination should be Africa and not elsewhere. Thank you.
Thank you, Director, for the clarity and, of course, the straightforward response relative to the stockpiling of vaccine for monkeypox. Thank you, Sarah Chen, for coming through with your question. I see Peter Fabricius is also up. He has his hand raised. He has also sent the question. Peter, which option will you prefer? Will you want us to read the question, or will you go ahead as your hand is raised? Hello, Peter.
Yeah, hi, can you hear me?
Yes, we can hear you. Go ahead.
Okay.
I think.
Well, I'll read it if you like. Okay, Dr. Ahmed, thanks for your briefing. My name is Peter Fabricius from Daily Maverick in South Africa. So recently, the Aspen pharmaceutical company in South Africa said it had not received a single order for the J&J vaccines it is making under license in South Africa. This company is particularly distressed that COVAX has not ordered a single vaccine in particular, but nor is anyone else from Africa. You know, this despite the AU and the Africa CDC target for South Africa, for Africa, I think, to produce something like 40% of its own vaccines. Why is Africa not buying vaccines from Aspen, the only company producing COVID vaccines in Africa, to the best of my knowledge? Thank you very much.
Thank you, Peter. Indeed, the slow purchase of vaccines that are manufactured here on the continent by our own member states, by our partners, by the intergovernmental organizations is a very big concern for us. Our heads of states have pronounced themselves very clearly that anyone buying vaccines for Africa must buy them here first and then supplement, if required, with those from outside of the continent. And we as Africa CDC are in a lot of discussions behind the scenes to make this a reality. At the moment, there is no African country that has asked for new purchases of Johnson & Johnson vaccines. But our position as Africa CDC and the Africa Union is any new vaccines that are going to be purchased by any member states on the continent is going to be directed towards the Aspen factory products. And the AVAT, when we are going to be purchasing any vaccines in the coming months, we are also going to be purchasing from African manufacturers before we consider any non-African manufacturers. We are, however, in consultation and discussions with institutions like Gavi and philanthropic organizations. So they too purchase from manufacturers here on the continent. It's taking a little bit of time, as many things legal do, but we are confident that this situation is going to change, considering the stages at which we are with the discussions. And as soon as that happens, we are going to be back here to provide you with an update as well.
Thank you, Director, for the response. We're still back on the topic of monkeypox. Peter just came in with the issue around COVID and vaccine, of course, which was very clearly answered there. So we go back to Dorcas. Dorcas, of course, the director mentioned in the briefing notes that Morocco is reporting or confirmed one case of monkeypox as the only non-endemic country on the continent that is reporting a case of monkeypox. So Dorcas' question here is, Africa has recorded more suspected cases of monkeypox than confirmed ones. Is the current capacity of testing a point of concern? Please repeat. And she added, please repeat the quantity of stockpiles of smallpox vaccines you mentioned.
No, thanks, Dorcas. The information we have in as far as stockpiling is concerned is that WHO is currently holding about 2.4 million doses of smallpox vaccine in its stockpile. And when that situation changes, we will be able to let you know. What they have also informed us is that there are pledges for more than 31 million additional doses. Those are not yet in stockpile, but those pledges have come through so that we have better numbers in the stockpile that can then be able to be used across the world. So 2.4 million doses in stock and 31 million doses have been pledged for the WHO stockpile in Geneva. The second part of your question is regarding the number of cases, and I will give an overview that we have, since the beginning of 2022, 1,495 cases. Of those, 1,406 are suspected and 89 are confirmed. And the reason for this is the relatively slower pace of laboratory confirmation. And we are working with the countries affected so that we have the correct reagents, the correct equipment and training for faster turnaround time for these suspected cases. We are, however, using clinical presentation and history of travel and engagement with the areas that have smallpox being reported to be able to ensure that these cases are appropriately isolated so that they do not continue to transmit within the population. So I repeat, of the 1,495 cases that we have, 1,406 are suspected, high index of suspicion, and 89 have been confirmed across this 8 member states that are reporting small monkeypox. Thank you.
Thank you for the clarity in the figures. Colleagues, remember, we are on the Q&A section of this press briefing. The medium to send in your question, +251 94550 2310 is the WhatsApp number, +251 94550 2310 is the WhatsApp number. Of course, you can use the Q&A, both the Q&A section and of course the raised hand. Talking about raised hand, we have our colleagues, one of our regulars, Sarah Javin. She has raised her hand. So we'll go to you, Sarah. Please go ahead. And Sarah is with, Devex.
Yeah, sorry, with Devex. Thanks so much for taking my question. Do you expect that the ministers will pass the amendments to give the Africa CDC autonomy? And what will that autonomy include? Or is it unclear that this will pass? And then what happens next after a positive vote, if it were to happen? Thank you.
Thank you, Sarah. We do expect that the amendments are going to be passed, but let's confirm that next week after the ministers have met. Second is what the autonomy entails is that Africa CDC will be able to operationally conduct all its activities within the agency. This means that any negotiation with partners will be done at our level. Any authorization for response by our staff and our subject matter experts will be done at our level. Any human resource capacity, any finance, any procurement that is required will be done at our level. And this will improve the speed at which we act whenever there is a disease threat. And it will also improve the way in which we plan for preparedness of any future disease threats as well. The next steps after the ministers have considered the statute next week will be for the amendments to be forwarded to the Executive Council in July. And the Executive Council will be acting on delegated authority from the Assembly of Heads of States. So they will be considering those amendments on delegated authority from the Assembly in July. And after the July Executive Council meeting, we will then say we have a new statute, and that new statute will then begin implementation immediately. Those are the next steps after next week.
Very clearly laid out for all of us here. Thank you very much for that clear response, Director. We still have our colleague Judith coming back. Remember, we still have a few minutes left for our briefing, about 12, 16, 17, if you write about the time on your end. So send your questions if you have, +251 94550 2310 is the WhatsApp number. And of course, you can come through on the Q&A and of course, use the raise hand icon on your Zoom screen. Judith Akolu from the Kenya Broadcasting Corporation has come back. She says, how many labs in Africa are able to test for monkeypox? And secondly, what is being done to help speed up the testing capacities, if any? That's from Judith.
Yes, no, thanks a lot, Judith. I do not at this stage have the number of laboratories that are actually doing testing. But I'll tell you that most of the national public health laboratories on the continent have the capacity to do it. What usually is required are the consumables. Do they have the test kits for the testing to actually be able to be done? And that is why we are actually ramping up our training and the provision of all these consumables and the test kits so that many more laboratories can be able to do it. But the numbers that I do not have, and our comms team will share that with you as soon as we get a better picture of how many are actually testing. But the message here is that the capacity is there. What we need are the test kits to be able to go out and to be used.
Thank you very much, Director, for that response. So our team has taken note. Hopefully we'll have that information for you in our next briefing once we get in contact with our laboratory colleagues. I'm sweeping through our different channels for questions. I don't see any new one coming in from our WhatsApp number, neither from our Q&A, or I don't see a hand raised at this point in time. So we will just do the usual. By the way, we've just got 11 minutes to go. So Director, will come back to you for your key takeaway points for this week, and then we can close up from here. Over to you.
Thank you, Nick, and thank you, colleagues of the media for participation today. I see we are shifting our attention slowly to monkeypox away from COVID. So I have three things I would like you to go away with today. The first is that the vaccination rate for COVID is still low in Africa, and we need to increase it because we do have the doses in place, and we are supporting our countries to increase vaccination, including giving booster doses. It's very important that we remember that vaccination for COVID is still one of the most effective ways of ensuring that we keep hospitalizations and serious illness low. This is one. Second is to say that on the continent of Africa, we have 10 countries who are endemic for monkeypox infection. 7 of those are currently having reported cases, and 1 non-endemic country is reporting a case. The message here being that although monkeypox is now spreading across the globe, it is endemic here in Africa, and any planning, any interventions that are designed for countries that are non-endemic, they should really begin with the countries that are endemic here on the continent so that we can control monkeypox from that source. The third message that I would like to have for you is that as Africa CDC is undergoing actually a double transition. John has transitions to PEPFAR, and now we are having Africa CDC as an institution also transitioning. The steps are now very advanced, transitioning into an autonomous institution of the African Union, and this is going to require support and understanding so that that transition process of Africa CDC is smooth and is quick. That way, we are ready for the next outbreak. We are ready for the next epidemic. We are ready for the next pandemic. These are my 3 messages for you today. And thank you very much for coming. And we look forward to your participation in next week's press as well.
Thank you very much, Director. 3 very clear and succinct messages there. Nothing extra to add. Our vaccination rates are low, especially for COVID. We need to beef up our vaccination. Of course, Africa CDC is having a double transition. And of course, monkeypox already exists in endemic countries. We need to start off any intervention from there as we move to non-endemic countries. So we've just got 8 minutes left to go. Let me say thanks to Director for making up the time, as usual, to engage with the media. Through the media, we are able to reach out to the population across the continent, informing them about the COVID situation all across the member states, 55 in the AU region. And of course, thanks to all of you, our colleagues from the media, for your patience and for always being here from the very beginning till now. You're still with us. We are all in this together, and your contribution is really, really, really appreciated. To my colleagues from both the AU and the Africa CDC, all of us behind the scenes, making this to happen and bringing the director interfacing with the media every week, I'd like to say thank you for being here this week. We look forward to seeing you, all of you, next week again, when we shall have new updates on both COVID and monkeypox, and of course, the Africa CDC transition process, which always interests our colleague, Sarah Jervin from DEVEC. Thank you all, and let's meet next week, same time, 12 p.m. East African time. Stay blessed. Thank you.
End it.